Most of us have probably heard references to a hospital cath lab, but unless you've been treated in one, you might not really know what happens there. Today, interventional cardiologist Dr. Ryan Hollenbeck from Mercy's Plum Heart Center joins us with some insight into the life-saving procedures that can take place there. Dr. Hollenbeck, thanks for joining us here today.
Thank you.
And tell us, what is a cath lab?
Yeah, so Cath lab is short for cardiac catherization laboratory, and it's just a place in the hospital where we perform a lot of heart procedures. We take pictures of the arteries that supply the heart with blood, and that's probably the most common thing we do in the cath lab.
And what are some reasons why patients might go there?
Yeah, there's really two main reasons, and this gets into why we use stents at all. One is if you're having a heart attack. People come to the cath lab, and then we can put a stent in, open up that blockage, and stop the heart attack. The other reason we put in stents is to help treat chest pain. And so, and that's an important thing that I think most people probably don't understand, is that stents don't prevent heart attacks. Stents are useful to treat a heart attack, and the only other reason we use stents is to help treat the symptoms of a blockage, to open up the blockage and restore the blood flow to the heart.
And so what tools and technology are you able to use to do that?
We have a lot of toys we play with in the cath lab. So, you know, you might hear the phrase balloon angioplasty. That's kind of an outdated term. We almost never use balloon angioplasty as a standalone procedure. We still use balloons, but the purpose of the balloon is to prep the vessel to put in a stent. We have other tools we use for that purpose. Atherectomy is actually, sometimes if we have calcified blockages, we have to shave some of the calcium down, and then we have an ultrasound-coated balloon called Shockwave that can kind of fracture the calcium. But all of that is to help deliver the stent and expand the stent to get a good result.
And so what point do you get a stent? Like, how bad does the blockage have to be?
Good question. Typically speaking, 70% or more. And the reason we say that is because we know that blockages that are less than that typically don't cause symptoms. And if you remember, you know, now if you're having a heart attack and you have 100% blockage, obviously you fix it. But anything less than 70% typically doesn't cause symptoms, and so we know people do really well with medical therapy in those situations.
All right, Dr. Hollenbeck, thanks for joining us here today.
Yeah, thank you.
And stay with TV9. We'll be right back.